Great.
Hello.
Hello, hey Mon.
How are you?
Good, how are you doing?
All right, not too bad.
Good.
Let's get this rolling.
Yeah. We'll get started in another minute or so. Thanks for joining, everybody. Kirsten, I'm going to pull up the PowerPoint presentation just so it's on the screen.
Great.
Can everybody see that, Kirsten? Give me a thumbs up. Okay.
Great.
And then just a reminder to folks to mute yourselves. We will absolutely offer opportunity for question and answer at the end of the introduction to the intake form. So for the time being, just to avoid background noise, we'll ask that you mute.
Well, I've got 12:02. Should we go ahead and strike it up?
Let's do it.
All right. Well, good afternoon, everyone. It is so wonderful to see everyone joining us today for your Children's Outcome Reporting and Evaluation first training here. We are delighted to have a real array of leaders and professionals who have put this together at your request. Really, CORE has been a labor of love that began truly in its planning stages in 2014, but really in great earnest over the last couple of years, frankly, as we brought together the technical expertise of ETI, and we have colleagues here, our incredible academic scholars from the Center for Advanced Studies and Child Welfare at CASHU, and then your colleagues from across the association to really develop a system that will be state-of-the-art, user-friendly, and cutting edge as it relates to how it is that we bring together an understanding of the children and families that are served so that we can ever increase our capacity to serve and develop our continuum ways that will increasingly meet the needs of our children, youth, and families. So it is with great enthusiasm that we launched today. And this has been a labor of love of Rachel Peterson, my colleague here at Aspire Minnesota. So I will delightfully hand the microphone to her.
Thanks, Kirsten. And thanks to all of you for being here. It's really great to see this many people on this webinar, and we are recording this too. So for your colleagues that aren't able to join us right now live, they will be able to watch the recorded version as well. And there will be time, as I mentioned previously, for question and answer at the end. So a little background information I think is important at this stage, because I know a number of you joining today are not familiar with CORE. And so I'll spend a little time doing an introduction of CORE. So back in 1985, Aspire Minnesota, under its previous name, the Minnesota Council of Residential Treatment Centers, received funding from the Bush Foundation to develop and implement what was called the Student Data Reporting System, SDRS, a system that many of you are familiar with. And for over 35 years, this system has provided member organizations with the ability to report on outcomes data, demonstrate efficacy, and promote improvements in service delivery while driving important discussions with stakeholders, with legislators, funders, and a variety of other partners. At the request of and guided by the Aspire Minnesota membership, the association has been conducting a complete system upgrade, renaming SDRS the Children's Outcome Reporting and Evaluation, or CORE system. Unlike its predecessor, SDRS, CORE is designed for all children's service providers, residential treatment, outpatient and related community-based services, and foster and relative care. And after hours of debate and exchange over the past few years regarding which data should be collected through CORE, data fields have been carefully curated by research and service leaders to ensure that the data would have immediate value for our goal of increasing understanding of services and promoting increased quality of services. So CORE has been designed to capture data that otherwise is not being reported. Data determined to be nice but not necessary will not be collected by CORE. Some parts of CORE are more clinically oriented, and the design of CORE allows for services that are not as clinical to continue to gain value from the data collected and outcomes reported, including foster care, services for youth experiencing homelessness or sexual exploitation, nurse home visiting, etc. So there was a briefing webinar about CORE held on October 28th. And if you haven't had a chance, if you weren't at the live recording or had a chance to view the recording of the webinar, it's on the Aspire Minnesota website, aspiremn.org, under the CORE tab. And we really encourage folks that haven't had a chance to view that webinar yet to do so. It's 1 hour long exactly, and it really is a great kind of high-level introduction to CORE and a good place to learn about some of the ins and outs of the system. So there are a lot of people that have been working really hard over the past years to bring CORE to life. The Aspire Minnesota CORE team includes Dawn Peterson from Northwood Children's Services, Heidi Seaton and Whitney Loisel from North Homes Child and Family Services, Dr. Anita Larson and Elena Gunther from Nexus Family Healing. And advising on content, reporting, and research potentials are Drs. Tracy Laliberte and Christy Peischer from the Center for Advanced Studies in Child Welfare at the University of Minnesota. And the team at Educational Technology Innovations, ETI, at the U of M leads the technological development of the CORE system. And we have a few representatives from ETI joining us on the call today. But of course, the most important people when it comes to CORE are all of you joining us from member organizations, leaders and staff alike. So a basic overview first. There are 5 main components of CORE, and those are listed here. The intake form, which we're going to be going through today, the discharge form, and we'll be training on that on December 20th, Monday at noon. There is a 6-month follow-up form. There are satisfaction surveys, and then of course, the big important reporting element. So all of these elements will have specific trainings designed. And the goal is to launch in January 2022, January 18th, to be specific. So these trainings will be happening prior to that date. And more on that a little bit later. The intake and discharge are key, kind of the 2 key.
Okay. All right, thank you so much.
Just a reminder. Hey, Heather, we're getting some feedback from you. Let's see. There, okay. Oops. Bumped us ahead. The intake and discharge forms are the 2 key parts that will require data entry from staff at member organizations. The 6-month follow-up form and the satisfaction surveys, we have a goal of having those administered first and foremost by text message to clients, parents, caregivers, and workers and placing agents. Also, having an email option as well if text message is not ideal. And those will be sent automatically. So there will really be no need for staff involvement or follow-up on those 2 items. Again, wanting to make this as user-friendly a system as possible, because when they respond to the survey or the follow-up form, those will come automatically into the CORE system. Again, we'll be training on these elements later. And then of course, the reporting piece is really key, and we'll be doing a training on that in January as well. So today is all about the intake form, and the purpose of this training today is to equip Aspire Minnesota member organizations to begin utilizing the CORE intake form in January 2022, coming right up. So we're going to move into a walkthrough. I've got screenshots of the intake, all elements of the intake form. We're going to do a walkthrough, and then at the end, we'll open up for question and answer and discussion. So diving right in. This is the first page of the intake form. It's the client demographics page. It has the beginning service date, gender, race, and ethnicity. And so you'll just have to select by checking whatever blocks or boxes are applicable. And then for the primary household dropdown, the options there are 1 adoptive parent, 1 foster parent, 1 birth parent, 1 relative caregiver, married or partnered birth parents, 1 birth parent with step parent or non-birth parent partner, married or partnered adoptive parents, 1 adoptive parent with step parent or non-birth parent partner, married or partnered foster parents, married or partnered relative caregivers, or no permanent living situation. For the indicate the client's grade level or last grade completed question, there are options for pre-K all the way through 12th grade, plus an option for enrolled in GED, graduated / GED, and then not available. So we're going to move on to the next page. So here you can see when we set this up, we used Hogwarts and Harry Potter as our example organization. So this is the intake form for Draco Malfoy. And here they're asking for parent and caregiver history and looking for substance abuse, diagnosis of mental illness, domestic violence victim, past or current incarceration, or substance abuse. And these question mark here are placeholders for links to what we're calling the user manual. So anytime that there's a question that a user of CORE has a question about the definition of something, like what do we mean by domestic violence victim, they'll be able to click on a little button that indicates that they'll access the user manual with a description, and we'll have lots of different descriptions kind of describing all the different elements and things that you might have questions about. So that's what that question mark is for. And they're just there as an example. They'll be kind of all over the place, really easily accessible by users of the CORE system. Moving on, there is a section on system and payer information. And for referral source, that dropdown includes county social worker, probation officer, parent or caregiver, doctor or hospital social worker, a relative, insurance company, or the service provider. And the options under the drop-down menu for primary payer are public insurance, private insurance, tribal funds, self-pay, and other option as well. And then there's the question for, is this placement or service court ordered? Moving on, we have the health information section, which is divided into physical health and mental health. So for the physical health piece, there's a check all that apply option. So that's straightforward. Under mental health, there's the prompt there to begin typing to select diagnoses. So they have an option for a primary and a secondary diagnoses. And when you click on that box and start to type into it, let's say attention deficit, that code and descriptor of the diagnosis will pop up and you can simply select it. So we wanted that again to be really easy, not having to write it in yourself or having to look up the specific code. I also just want to say to my Aspire Minnesota CORE team colleagues to feel free to jump in at any time. I think there's, this team is really familiar with this intake form. We've spent, hours on it. So if I forget something or overlook something, feel free to jump in. Okay, the next section is maltreatment history, experiences of abuse or neglect, and check all maltreatment experienced by the client. And the options here, as you see, are mental injury, neglect, physical abuse, sexual abuse, threatened injury, and sexual exploitation. And again, the user manual will help to identify what do we mean by, and I'll document it as fairly straightforward, but what do we mean by suspected / not documented or none known or suspected? Because of course we want people to be thinking about these different categories in exactly the same way. So the system will provide guidance in a lot of different areas. Moving on, placement information. Is the client a ward of the state? Yes, no, or unknown. Has the client been legally adopted? So this next section is still a work in progress. We really just wanted you to see this is the living situation section. And this is a piece that we're really actively still working on. And so it will not look as it does here, but the categories that we've identified are ones that we'll be looking for. And this is living situation prior to intake, and the current living situation, and the number of episodes in a variety of different living situations for the client. And the way that it's set up here isn't the way, as I mentioned, that it's going to be in the finalized intake form, but these are the categories that will be asked about within CORE. And then, and then the question about the client having experienced homelessness, yes, no, or unknown. There is a section called Other System Involvement and Service. Has the client received any of the following services throughout their life? In-home CTSS, there's an option for yes, no, and unknown. Youth Act, outpatient substance use disorder treatment, outpatient clinic-based mental health services, day treatment, and partial hospitalization. Then there's a section on that same page about school-related services, so you can select all that apply in this category as well. And then is the section, we're nearing the end, folks, of presenting problems. This first page is the internalizing behaviors. Indicate the client's frequency of experience or engagement in the following internalizing behaviors. And there are these different categories across the top: never, rarely, sometimes, often, always, unknown, or not applicable. And you can see that that is the full list there. It's not cut off or anything. So I'll give you a moment to peruse that internalizing behaviors list before moving on to the externalizing behaviors list. So again, same format here: never, rarely, sometimes, often, always, unknown, or not applicable. All right, and this is the final section of the intake form, and it's the assessment section. So some Aspire Minnesota member organizations administer client assessments upon intake, while others do not. For those not administering these types of assessments, there will be an option to bypass the top section here underneath overall assessments. So these top 6 assessments, it will be, you can bypass that if you don't administer assessments. For those entities that do administer any of these assessments, you'll need to enter final scores and in some cases subscores for at least one of the 6 listed. So strength and difficulties questionnaire, child and adolescent needs and strengths assessment, early childhood service intensity instrument, child and adolescent service intensity instrument, youth level of service inventory, or the problem-oriented screening instrument for teenagers. So happy to talk more about that piece in the Q&A if you have questions about that. But again, we're looking for the composite scores, not all of the data collected through those assessments. And then at the bottom, you see this piece that says trauma assessment. So one of the really great assets of the core system is the inclusion of the University of Minnesota's 5-question traumatic stress screen for children and adolescents, the TSSCA. So the TSSCA was designed to provide practitioners with an efficient yet precise tool for screening and identifying children ages 5 to 18 years that may have experienced a traumatic event, and in so doing, equip members with a greater understanding of trauma symptoms so that services can better support the child. And this is one that will be required for all intakes, the TSSCA assessment. So that is the final piece of the intake form, which means that we'll now, you can now unmute if you have any burning questions, and we will, the team at the core team at Aspire Minnesota and at ETI will do our best to answer your questions.
Thanks so much, Rachel. And we are very anxious to hear everyone's comments and questions. And thanks so much for this presentation. It was very helpful. You know, our goal in walking through all of this is really to equip you, but also get you thinking internally about how to best operationalize the inclusion of core moving forward. And we know it'll be an iterative process, as has been the development of core to begin with. We had anticipated we might be able to go live a little bit earlier than now, but are really excited to share that we will be in a go live place for the whole core system on the 18th of January. And so we are beginning core, launching core to collect data in 2022 and saying thank you and good night to our former SDRS system. And so we are beseeching you, imploring you, asking that you please begin tracking all of your intakes beginning in January. And my question to you is, because there will be a couple of weeks gap between that beginning of January and the go live officially of core, if you are able to wait to input the data on the 18th and after on your kiddos, or if you prefer that we come up with some sort of kind of temporary Excel spreadsheet where you could input data in the meantime. Curious about your thoughts on that, and just also wanted to share that timing update. Also glad to take all of the other questions, but.
So I would say for Port anyway, we are small enough that we would be able to enter all the data in on the 18th going back to January 1st.
Thanks, Heather. Are there others for
one the function we had.
I think there's some.
Abdus, we have a really hard time hearing you. As you look for another microphone or type your question in the chat, we have a question from Heidi Schlewitz-Kruger. She said, sorry if I missed this part. Will there be a PDF version of the intake criteria options that way we can prepare the info before starting to enter it into the system?
Yes, I mean, absolutely. We can share that with everybody so that you're really familiar with it. We'll probably actually take some of these screenshots from today's presentation to share with you. And we can make those available as well on the core tab on the Aspire Min website, so that you can access them there as well. But that's a great point, Heidi. Thank you.
Rachel, this is Tim at the ranch. I'm wondering how much of the form will be filled out from data imported from our online intake form already.
That is a great question and a really important one, and one that from the very beginning of discussions about moving from SDRS to core has been really key. Core is designed to be, again, very user-friendly and to eliminate as much duplicative data entry as possible. And ETI, our developers at the University of Minnesota, spent a lot of time this summer working on the EHR integration piece. And it is, to say the least, complicated because there are many different EHRs in use. But a main goal of CORE in the first months of its existence is for those organizations that utilize EHRs to have an option to carry over kind of the basic demographic client data from your EHR directly into CORE. That is not the case yet, but it's on the top of the list of must-haves. So we are absolutely thinking about that.
Rachel, we have another question from Joanna Essler. She asked, under payer, if we charge counties a per diem directly, do we use the other choice from the drop-down menu?
That's a great question. Kirsten, do you have any insight on that? Also, can I just jump in, Kirsten, and say, if you've seen things as we've walked through this intake form, that there is some room for adjustments. If you see something that is sort of blatantly missing, please let us know. So this could be a case for more clarification, but I interrupted you, Kirsten.
I think that is a great response.
Okay.
Thanks for bringing that to our attention, Joanna.
Rachel, Tim again, another question.
Yep.
Can the intake or the data entry form, can that be updated periodically? Like, let's say we don't know really the living situation, parental history, and then we find that out 3 weeks later. Is that an option?
Yes, great question, Tim. And yes, the way that the intake form is being set up by our team at ETI is such that when everything on the intake form is required. Now there will always, not always, but there will sometimes be options for not applicable or unknown. But everything, in order for the intake form to automatically be marked as complete, every question has to be answered. And there will be an option to sort of save progress without submitting. And then you can, for exactly the situation you described, Tim, then you can go back once you have that placement, living placement information or whatever it is that you're specifically kind of waiting on, and enter that into the intake form. And as soon as you have all of the fields entered, it will automatically become sort of finalized, the intake form, which then will also open up access to the discharge form for when you're filling that out later.
We have a couple of other questions on the chat that I'll share with you, Rachel, and you certainly can call on others if that would be of interest. Is this meant to be all client reported data? For instance, externalizing behaviors, is that the clinician report, kid report, or parent report?
Oh, I will, I'm just looking to see who was on from, let's see. That's a great question. I'm looking at the chat again here. I just opened up. Is this meant to be all client reported data? For instance, externalizing behaviors. Is that the clinician report, kid report, or parent report? I don't know how to answer that one. Kirsten, do you have a leading, or is this a point for discussion if other people have thoughts about this?
I would yield to our Aspire Minnesota colleagues, but my understanding is that this is really being filled in by the clinician as opposed to engaging with the family in a discussion about this.
This is Drea from the ranch. I guess I have a question about that, because typically what we've been doing with like the SRD or SDRS stuff is the intake checklist gets filled out by either the referral worker or the parent. So is that going to be, and then that's the like data we've been entering is like, if they're saying their kid is having these externalizing behaviors, is that going to still work? Or are you wanting us as like they're intaking it here, that we would automatically be answering those questions like as the clinician who's taking over? I hope that made sense.
Hi, this is Heidi with North Homes. Just a couple of things. I think whoever knows the child best and knows most accurately what is true as far as the behaviors is where we want to pull that information from. It may be a clinician in some instances, but it might, you know, in the current SDRS, we do the intake form during the intake meeting. And so a lot of that information comes from parents if they're there, or workers if they're there. And if, you know, depending on how long that relationship is, a lot of times they do have good insight into what those, you know, the issues are at intake going into the service. So I don't think we want to get too prescriptive as to where it comes from, as long as it's accurate. And that's going to, you know, maybe differ from case to case.
Thanks, Heidi.
The next question is, will we need to continue to have a student ID?
There will be an ID number created for every intake that's created. So you won't need to keep track of that. That will be built in within the system, within the core system.
The next question is, will you have access without us, quote, submitting, or do we still have to submit quarterly? If we submit, then we could enter information as we get it, if not upon arrival.
Yeah, so this will be, the way that we'd like to have this happen is sort of up to individual organizations. Again, one of the big goals for CORE is the ease in reporting and being able to pull your own organizational reports whenever you want that are helpful in guiding your own specific work. So that you can do at any time with, you know, the data that has been, you know, fully submitted or completed. And then Aspire Minnesota will also pull aggregate reports across the association as well. We'll have access to do that. You won't have access to compare yourselves to other organizations, but we can kind of do that for you. So does that answer your question, Joanna? Great.
Yes.
Are there other questions? All right. So do the Aspire Minnesota core team or ETI have any comments? Have I forgotten important information here that needs to be shared? One more pause.
I think we're good on the ETI side.
Great. Thanks, John.
I'll just mention, or maybe pass you that. Oh, go ahead, Don.
Oh, I was just gonna say, for me, I think you did a good job of explaining it. So I don't think you left anything out, Rachel. Thanks.
Thanks, Don.
And so our next steps on training will be, to go through the discharge form. So your responsibilities are these two components, intake and discharge. And then we'll have another conversation about the satisfaction surveys and follow-ups that will be administered via text message, and then the reporting structures. And those are some of the most exciting parts, particularly the reporting, because unlike SDRS, you'll be able to pull your own reports on your own clients and do that in a timely way that reflects your interest in that data for your organizational purposes. So those will be announced soon, though the discharge is the 20th.
Yep, the 20th at noon. It's on Monday. So we'll do the same process here, except just with the discharge form. And as you can imagine, there are carryovers from the intake because it's a comparative assessment. So great. I'm going to pause once more for questions.
Rachel,
I guess I
Tim
do have
again.
one more.
Oh, go ahead. I'll wait.
Okay. I have one more question. I know on the slide where you were talking about where a kid was before they came here, I didn't see anything listed as far as like juvenile detention centers. And we do have clientele who come from those. Would they get classified under another option then? Or like, would that be considered inpatient, or where would you classify that?
I'll take a look at that list. I'm making a note here about that. And it's something that we definitely could add if we feel like there isn't a good spot for where that would fit. So I'm making note of that. Thank you so much.
Thanks.
I have a question, and I might be just jumping the gun on this. I know you probably will do it at the discharge one. So if a kid was intaked in 2021 and discharged in 2022, are we still using the old forms? And then also the 6-month follow-ups for anything for 2021.
So Jill, what we're asking folks to do starting in 2022 is their new client intakes.
Okay.
There will be an option to include 2021 intakes if you so desire. But that is not a requirement for.
So are we going to use both systems? Say if a kid was intaked in say 2018 and he's discharged January 2nd of 2022, are we still using the old forms depending on if the old system, if they're intaked on the old system? I guess that's probably the best way to ask it.
That's a really good question. Kirsten, do you have thoughts about that? Our goal was to sort of put SDRS to bed at the very end of 2021.
That is a really good question that we have not discussed. And so I think that we need to have some discussion about how to honor the data that we really want to wrap up. I would anticipate if we enter with the SDRS, we would conclude that process of discharging with SDRS. But again, I'd really prefer that we talk a little bit more with our advisors from the Aspire Minnesota work team.
Okay.
Thank you for bringing that forward. Go ahead.
Yeah, and then the 6-month follow-ups for anything prior.
Mm-hmm. Great. Thank you so much.
Thank you.
And we have one more question. How and where will we access the core reporting system itself?
There will be a really simple URL that will be something connected to aspiremn.org. I don't want to share, I think we have it determined at this point, but you'll just type it in. It's the website that you go to and can log on via your desktop computer, your laptop, your phone. So super simple.
So I apologize if this would be in the user piece of this at all, or the user help, but wondering, I saw the adoption piece. So if we have a client who's been adopted legally twice and then brought back to the system, no legal guardian at the time, do we leave that legal adoption out? Because I have a client who will have 2 legal adoptions, but is currently up for adoption again.
Yeah, yes, that's part of our internal discussion on the prior placements piece as well. We've kind of had that same question ourselves. So thank you for bringing that up, because it's a good point for those who have had more than one adoption experience. So I'm just going to add that to my list again to dig into.
Okay, thank you all for.
I was just going to say, I'm pausing for like a few more seconds here. All right, go ahead, Kirsten.
I was just going to say, are there any excluded programs that we work with that should not use CORE? This system was really designed to kind of be the next iteration of SDRS in many ways, including really inviting all services to be included in CORE moving forward. So, we understand that some of those more community-based services that don't necessarily include a mental health assessment, for example, won't participate in all of the fields of CORE, but the hope and expectation is that there's both value for you all in using CORE for all services, and that would apply for kids and families, and that there's value for the field in telling that wider story. And I was just going to make a comment that, you know, we continue to think of core as the best thing since sliced bread. It's really exciting. It's, you know, going to be wowing everyone as it relates to the difference between our SDRS and our core system. And as you can see, it's a joint venture, meaning it's taken everyone's energy, intelligence, and technical know-how to get us this place. And we are really grateful to all of you for your questions and engagement, for us to continue to smooth the wrinkles and make this a workable go beginning officially now on the 18th of January. So great gratitude to all of you, and we will continue to learn together and celebrate what it is to use this system moving forward.
Thank you, everybody. And I look forward to seeing you on Monday at the discharge form training. Take care, everybody. Have a good rest of your day.